So I'm going to explain some restraint methods to keep exposure down for the person taking the radiograph. So if we're doing a
are they in the middle of it?
forelimb or hind limb, we can use a piece of tape to kind of hold the limb down. That way we don't have to physically restrain it with our hands. We can also do a rope tie onto the foot on the front or back legs just to hold it kind of straight. So we'll loop it once and then you can just pull it into position like this. Also V-trough just to keep them straight on the VDs of abdomen and thorax. And then we also have sandbags just to keep them straight. We have the foam pads just to keep them from rolling around, just to make a more sturdy surface. Just anything to keep our hands and bodies more away from this primary beam that's going down. You never want any part of your body to be in the primary beam no matter what, even if it's exposed with a lead glove or apron. So the three types of restraint are physical, chemical, and the restraint using different tools. So physical restraint would be, or manual restraint would be people actually restraining the patient with their hands or bodies, and then chemical restraint would be using a sedation like dexdomitor or something to keep the patient asleep, or using the V-trough or ropes, foam pads, things like that, would to limit exposure for the person taking an x-ray, keep them as far away from the primary beam as possible. So I'll be going over some PPE or personal protective equipment for x-ray. So the first thing is this dosimetry badge. We use a company that makes these for us. It's just a film wrapped in a light-proof envelope. So that what this does is it tracks the ionized radiation absorbed from the x-ray, and then ours are calculated quarterly. And then the maximal permissible dose for a veterinary technician is 5 rems per year. So if we have anything over that, it's not good. You don't want to have any at all. And that's measured quarterly. And then we have this lead gown that we do x-ray the thyroid shield in the gown every 12 months just to make sure there's no holes or cracks in the lead. And then the lead gloves here, we x-ray every 6 months to make sure there's no cracks or holes. And also when you're restraining with gloves, you don't want the animal to bite or chew on the gloves because that can lead to holes in the lead as well. Thyroid shield does cover thyroid up here, so it covers right here. The dosimetry badge gets placed right here, and it's more on outside of the gown on the thyroid level. And then the reason why people under 18 cannot be in here, they should not be around x-ray, helping with x-ray, or even exposed to it at all in an occupational level. And then pregnant women, also first trimester, very sensitive to radiation. It can damage the fetus, damage cells, and that's not good. We don't want anyone to be exposed to radiation at all. So using PPE and following safety measures really is important. And then also ALARA is making sure you use the least high radiation to get the quality image that you need, and then also limiting retakes, using sedated patients, using your restraint techniques, V-troughs, and then of course all of your protective equipment. And we also have lead glasses, eye protection that we use as well, and that is the personal safety regulations for x-rays. So our dosimetry report is right here. So it's sent in quarterly, so every 3 months, and we send it to the dosimetry lab to measure the amount of radiation that's been exposed to our badges and to our bodies. So here's my line right here. So as you can see, for the quarter I have 0 exposure to radiation, and for the year I have no exposure yet either. So our equipment's working properly, we're taking x-rays adequately, and we don't have any exposure there. So the limits for whole body is 5,000 millirems a year, lens of the eye 15,000 millirems a year, the skin is 50,000 millirems a year, and the extremity 50,000 as well. Alright, so we're going to do a lateral tibia-fibia x-ray. So we're going to measure at the mid-shaft of the tibia and fibia. So he's going to be in lateral recumbency with the limb affected pointed down, or limb affected toward the table. So we're going to do, it's at 3 right now, so we're going to look at our technique chart on extremities, and it's on 100. So we're going to come over here to our machine, flip it to 100, which is small focus, and extremities, and 3 would be 52 kVp. So just just gonna go 52 kVp. All right, so that's 52, and we're on 100, and 1/60 is what it's saying as well. So the MAS would be 1.67 for that view. And then coming over here to collimate the x-ray, we're going to want to include the distal femur or the proximal femur at the bottom, and then the third of the tarsus too. So we're going to want to just include that, and then the other leg we're going to hold at the stifle and hold it out of the view. So that is how your x-ray should look right here. So we're actually going to get our label. This is his right leg down. Okay, so we're going to put that right there and then hold this out of the way while we take the x-ray. And as you can see, our computer's already extremities, his name, leg, and lateral. Alright, so I'm going to go ahead and take that. So holding this one out of the way. And making sure we have that femur and tarsus in there also. Making sure none of my body parts are in the primary beam. I'm just going to pick it. Alright, and that is how you do lateral tibia and fibia x-ray on a dog. So today we're going to do craniocaudal of the radius and ulna. So the measurement for that is mid-shaft of radius and ulna on this cat here. So mid-shaft radius and ulna measurement. We're going to get about 2. So we're going to look at our technique chart here for extremities. So we have 100 as the focus and then 50 as the kVp. So we have it on 100 and we're just going to go to 50. Right, now that I've set the machine, we're going to position him. So we're going to use a piece of tape to limit the amount of exposure that we're going to get. So we're just going to pull his arm up and then just tape it in place right here. Okay, and then the view is proximal to the elbow and distal to the carpus. So we're going to put the left marker right here beside the carpus. And then we're going to want to collimate down so that the elbow is in the view and the carpus is in the view as well. So right, so as you can see, so we're just going to position and hold like that. So I'm just going to put on the lead gloves. And then I'm just going to gently pick up his head. And then I'm just going to hold him like this, and then I will hit the pedal to the x-ray. Alright, and that is how you do craniocaudal of the carpus, or the radius and ulna. Alright, so we're going to measure and position and take an exposure of a patient. So we're going to use a caliper. We have a stationary machine. So the measurement, this is abdomen, so it's going to be on the thickest part of the last rib right here. So it's going to be 16 is our measurement, and we're going to look at our technique chart, find abdomen, and okay. So our MA is 20, our time is 1/60, and the MAS is 3.3. And we're going to find 16, so we're going to do 80 kVp. So click up to 80. Alright, we're on 200, and then 1/60 right here. Alright, and that is how you measure for that. So the collimation for lateral abdominal x-ray, so we're going to want them on right lateral recumbency. Then the cranial border is, you're going to want to include the diaphragm and the apex of the heart. So we're actually going to move that down a little bit. And then the caudal border at the end is going to be the coxofemoral joints. The Dorsal border is going to be the spinous process, and then the sternum, of course, up here. So what you're going to want to do when you take an x-ray of the abdomen is extend the front legs cranially and then the hind limbs caudally, so it looks like this. And I'm actually going to take an exposure of him. Put leg gloves on. So now that his front legs are extended cranially, I can just go ahead and come back to the back here, hold the back legs, and then I'm going to go ahead and hit my acquire button right here. And then we're going to wait for it to count down for the exposure. Make sure all other personnel are out of the room right now. Is ready for exposure now, so just pulling those hind legs down and then click the pedal and expose the image. So we're going to be positioning for a VD thorax today. So we put the cat in the V trough. We have our right marker on the right side. So he is sedated, so we'll reduce the number of retakes, and we're just going to collimate down really quick before we'll measure first. That's going to be done on the last rib, so just take him out of the trough. So measuring on the last rib now that he is in position. So just measuring down onto the last rib there. It's about 9. So we'll look at our technique chart here for thorax. So for 9, it's going to be 72. So we're going to put our machine on 72 and 100. Right, now that our machine's set to this cat's weight or size, we're going to put him back into the V trough. This just keeps everything straightened up for us. And we're going to move him up a little bit. Okay, and then to collimate, the cranial border is at the thoracic inlet, so we're just going to kind of collimate down that way. So it's about right here. It's where you're going to want to go. And then the caudal border is the first lumbar vertebrae, so it's about right there. All right. And then we want to get the entire V trough in the collimated area. So then I put on leg gloves. And then I'm just going to kind of hold his feet more straight. And now that he's really straight, we're going to wait till inhalation. And then we're just going to click the pedal down. Right? And that is how you do a VD X-ray thorax on a cat. Alright, so we're going to label this image. So when we accept an image, it automatically puts on the permanent label, the patient's name, patient's birthday, and the hospital name and the date. So what we're going to do is we're going to put the marker on, and then we're actually going to do free text, and then we're going to type in lateral abdomen. And then we're going to click OK, and then we're going to put that up here. Actually, in the inguinal area down here, we're going to put the markers. So right and left, since we do have a digital system, we don't have the lead markers, so we actually do put the markers on here. So then we're going to hit check, and then we're going to exit, and then we can pull up the study right here. And then, as you can see right here, is the permanent name, or the permanent label, Smith Mountain Lake Animal Hospital, the chart number, patient's name, information, and then down here it says abdomen lateral. And then when we actually burn it to the disc, it will have the annotations on there as well.
Go.
So I'm going to enter the information in for our x-ray here. So I'm going to hit create new study, and then the client ID / animal name is going to be the chart number, so it's 5505. The animal's name is Freya. So if this comes up, it's since their other pet already had x-rays, we do have to close out. and then we're going to create new study again, type the chart number in, and then type a capital RH, since her name's Reyes. So then we can enter her information. So RHEA, last name is Gray, Gray. And she is a female and she's spayed. Alright. So date of birth, we're going to enter. Okay. And then study description over here, we're actually doing pelvis, so we're going to hit pelvis, and then body part again, pelvis slash hips, and then species down here, canine, breed, we're going to select breed, and then make sure everything's correct on there. Then we're going to hit acquire, and then the x-ray machine, once it comes up, we're going to hit dog, and then pelvis, and then we're going to do a VD. So then it's ready to just hit acquire, measure her, set the machine, and then we can take the x-ray. So now I'm going to be showing you how to locate a patient's files of everything we've done. So if you want to click here, we can type in the animal's name. So I'm going to type in Shotzi. So I'm going to type in the first letters of her name, and she comes up right here. So these are all the studies we've done on her. Her date of birth right here, the study description right here, study date and time, and then just the description of what we did. So left front leg, extremity, thorax, abdomen, thorax twice, hind leg, and then also if we were to burn those to a CD, we would click all of them. You could hit control and then click all of them and burn those all to one disk. And that is how we would do that. So now I'll be entering an entry into the radiographic log that's non-digital. So we're going to put the date here, so today's date, and then the owner's last name, so we did an x-ray on my dog today, and then my chart number is 8100. The dog's name is Remington, and then the study description, we did an abdomen x-ray, lateral and VD. So we're going to put lateral and VD on there. And then her KVP was 78. And then if you look on the technique chart here, so for abdomen, we use 200 and 1/60, so her MAS would be 3.3. And then I would just put my initials right here for it. And that is how you do an entry into a non-digital radiographic log. Alright, so to put the information into a patient's chart after we take an x-ray or ultrasound, so if you look right here, it's a mode, DR is x-ray and US is ultrasound. So we don't have digital charts here, so we just have paper charts. So what we do is we would hit control on both of those, so now both of her images are selected down here, and then we would just burn that to a disk and then put the disk into the chart like this, because we do not have digital charts yet. So we would just burn them to a disk and then attach that to the physical file itself. And then we also keep a record in here of the patient, last name, first name, date of birth, ID, study description. So everything's kept on the both digital and the disk in the paper chart. Cut! Okay. So today we'll be doing a barium series on this dog, Mia here. So she's been eating her toys and she hasn't had a bowel movement in 4 to 5 days. Every time she eats, she vomits. So we're going to see if there's an obstruction. So you have the barium sulfate here. We have already reconstituted, shaken it up. So we need to give 240 ml. So we have 60 ml syringes. So I'm going to give 4 of these. I'm only going to record giving 1 syringe for time's sake, but and I have a bib on the patient here to limit the amount of barium she gets on her skin. Okay. it's going to leak out. That's why we give 240 mLs. Okay, so we're going to give 3 more syringes and then I'll be back to video taking the x-rays. So we just gave 240 mLs of barium, so now we're going to take an immediately post x-ray of her abdomen, lateral and VD. So we're going to do the lateral really quick if you'll hit acquire for us, Victoria. We have her in the computer already. Birthday, name, sex, age. Just wait for that to come up on the screen. You can let her sleep. And as soon as that comes up, right here. Alright, so as you can see, the barium's there, so I'm just going to put annotations. So her right side was down on the table, so I'm going to put a right indicator marker right here, and then annotations, free text, going to write annotations right here, annotations, free text, and then I'm going to write immediately post. We're just going to put that out of the way, so right there, and then we'll save the image, and then we'll do the VD really quick. So we did a barium series on Maya today. We just took the last x-ray at 2:05. So the first x-ray here is just the VD of when she first came in with no barium at all. This is the lateral. And then immediately post, you can see it's in her stomach and slowly going out. And then the VD in her stomach, slowly going out of the stomach. And then 30 minutes afterwards, definitely some in the small intestine. And there's the VD 30 minutes afterwards. In an hour, definitely into the small intestine already. Then this is 2 hours post VD. And then again. And then
excuse me for a
one definitely moving further there.
A little delay in this because we lost power.
This is the 4-hour post, so the one we just now took. You can see that it's in the colon, almost to the rectum now. So definitely not obstructed, not blocked. So we're just going to treat otherwise because she doesn't have a blockage. We're going to do a OFA x-ray on the stall here, sedated. So we're going to measure at the widest part of the hip. So right here, we're going to measure while she's in position. So we're getting a measurement of 13. So we're going to come over to our technique chart on 13, pelvis.
Well, I removed it completely.
Right, so 300 is our large focus. So we're going to go 74.
So I mean, it boils down if you want us to find out what it is. And I recommend it, but the problem is it's not $120.
Right, so it's ready now. So we're going to put on.
Yeah, it's predictive. Then you can say, oh gosh, okay, it's this, and this is what's going to happen. You can look at it with bigger margins. You can just say, hey, it's the benign thing, don't worry about it, or this is something that is going to come back.
And the over the great short fusion on both sides, and then legs parallel to each other. Pull, stifles medially.
It's a good idea.
Make sure the hips line up, and then your center is going to be.
Yeah. Okay. All right. We'll find out what it is. Get it back in about a week's time period. All right. But he'll be ready to roll on. We'll give it another hour or so.
Tuberosities and then cranial.
All right, now.
The iliac or the pelvis, and then we're going to.
I thought I heard that she got a job down at
collimate down
at Moosey's
on the lateral, and then the caudal aspect is.
Oh, that wasn't. Was it the other sister?
So. Stifles rotated in.
Okay.
We got the knees in here.
Well, Braylon.
And we're just gonna go ahead and hit acquire.
Yeah, no. What's gonna? I thought I could have sworn that when I saw Missy and she told me that.
It's counting down.
Okay. All right. I'll leave a note for Braylon because that's what we're doing right now. We're in that process of getting some high school kids, and she's gonna want to potentially work next year, right? As long as it's not during track season. Yeah. Yeah, she does. Does she do cross country too? Does she do fall cross country or just spring?
Wait for it to transfer the image over.
Okay. Okay. All right. That sounds good. I'll pass it on.
Once the image transfers over, I'm going to put the left directional marker. The image is right here. So I'm just going to put the left directional marker on the left side over here, and then I will submit the image for view.